Ajit Kumar. He's a co-founder and MD at Sirix Healthcare, which is one of the leading service provider for medical equipments and maintenance of those equipments in India. So Ajit has been running this business for more than 20 years now.
Correct.
And most of your business is with the state government. So you work across 8 states in India, and you have operations in the Middle East region as well.
We are in fact covering 11 states in the country.
Okay.
Wherein we closely work with the 4 state government, actively engaging with the 4 state government.
Right.
Other than that, we have 3 more engagement with partial engagement with the other 3 more state governments. So state government engagement is total 7.
Right.
Then other area we are working in a private sector.
Okay.
So overall 11 states we have presence.
If you can take us through your journey of last 20 years, how the industry has evolved, especially in your segment, and then we'll probably take it from there.
We are, as you rightly mentioned, we are more into medical equipment services.
Yes.
Our core activity is multi-vendor, multi-modality medical equipment services.
Yeah.
Then we are into medical equipment trade, calibration and training development of medical equipment and consumable space. If we are saying our entire activity, this is the way what we are doing.
Right.
Sales, service, calibration and technical training.
But main is services. Right?
Yeah, out of our major focus is a multi-modality, multi-vendor service providing.
Okay.
What it means is, in a hospital, there is a lot of medical equipments are there, which is made by so many different OEMs,
Yes.
supplied by different distributors.
Correct.
So for the maintenance of each and every equipment, the hospital management need to run around with different engage with the different service provider, different companies.
Right.
So which is become a challenge. So we are a one-stop solution provider for that complete medical equipment maintenance and management.
So since you said you work with across various equipments, across various brands of related to different OEMs, so your role starts after the expiry of the warranty from the OEMs?
Yeah, generally our major activity happen after the expiry of the warranty.
Yeah.
But when I said this medical equipment management, maintenance and management,
that could be from day one.
where if there is a new equipment installed, whether the OEM is coming and giving the or the doing the calibration or preventive maintenance, all those periodic checks is happening on time. All those things we track, and we will also engage with this OEM to ensure that these things are happening on time. So that also a part of the management. Generally, majority of our work start from after the warranty period.
And these contracts are usually long-term contracts or short-term contracts?
Yes, this is actually a kind of project. It is a long-time contract because when we are getting into such kind of projects, what happens? We also need to deploy a lot of infrastructure in that particular area. Depends on the criticality of the equipment. We also need to keep certain standby equipment, standby spare parts, engineers, and the dashboard, infra, everything we need to arrange. That's why generally these all are typically large contracts and long-term contracts.
Right. So, and Ajit, how are you seeing this whole maintenance and management service industry? How have you seen it over the years, and how do you see, is it further, because you've been growing at almost 40-50% CAGR over the last few years, and when I spoke to you last, you said even in the next few years you expect to grow at 60% CAGR.
60%.
So, what is your view on how the industry is evolving and the competitors in the sort of segment that you operate in?
So India is a very vast country. I'm talking about India scenario, even though we are working in a Middle East, I'm talking about India scenario. India, there is a lot of government hospital where state government facilities are there, then medical colleges are there, central government directly owned facilities are there. So government itself is investing a lot into the healthcare system where a lot of medical equipments are coming in.
Yeah.
Second, in Indian scenario, private sector is also very huge and wide.
Correct.
It is there is no organized service provider in this case at this moment. So government itself is having a huge, there is a certain medical equipment maintenance as per the records. Government is having more than 50,000 plus crores of worth of medical equipments at this moment available in the government system itself.
Right.
Private sector.
And these are owned equipments.
Yes. It's old equipment.
Owned equipment, not leased.
Government, no, not leased. It's owned equipment. So private hospital is much more
Larger
larger, and the market share is more in the private sector. So there is a huge potential, huge market
market is big.
is there.
Yeah.
But there is no organized player. Again, there is no organized player because of the complexity of the operations. Because a lot of infra required, people required, technical know-how required, the tools required. So these all are not that easy to arrange
Build the
everything together.
ecosystem. Yeah.
Everything together. That is why organized players are comparatively less, but still people are there.
Is there a role of technology that you see is going to have in the future to make it less people intensive uh, sort of business?
Of course, there is a technology. One of our motto is also to bring technology into the services. Definitely, technology can play a lot of role in this. Now, what is happening is we are doing a active maintenance. That means once the equipment is having some problem, we are going and repairing it.
Yeah.
There is an option for preventive maintenance. Preventive in the
Yes.
sense proactive maintenance, where we are predicting, okay, there is a possibility that this equipment can go wrong in a
So
near
AI
future.
has a role to play.
Instead of AI also can play a role, of course, but instead of AI, there is a other certain technologies, IoT devices,
Yeah.
the monitoring, much other monitoring devices. Through that, there is a
You
options
can
to
track.
predict, track, and predict. Through that also, we can check the utilization of equipment, how much
And the health
this
of the
equipment,
equipment.
yeah, health of the equipment, and how much it is actively engaged with the patient. Everything we can understand over a period of time. So technology definitely can play do a big role in this case. Currently, it is not available. Again, say currently it is not available. But again, if there is a hardware failure happens, somebody needs to go there physically to replace the hardware. If software failure, we can manage it remotely. If the internet and all the Wi-Fi and network options are available in the health facility in a proper manner,
Yeah.
then that is possible. Otherwise, definitely we need a persons to go and doing the preventive maintenance. Of course, we need to touch the equipment, we need to open the equipment, we need to handle the other repair and maintenance. So that for that, people definitely required. So technology will help to minimize the breakdown duration. It will increase the uptime and the hospital, that usability of the equipment, everything will increase because of the technology. But for the maintenance aspect, currently people also required.
And what is the role of government policies on your business?
Government policy is, of course, it impacts in a both the way, in a positive direction also, in other way also. Government policies is impacting, that is also in a two way. If anything related to Ayushman Bharat thing, or NABH guidelines to hospital, NABH
Yes.
guidelines to hospital, which is definitely affecting their patient treatment. If the NABH guideline is coming up with the saying that, okay, you need to conduct every 6 months the calibration required, so automatically that number of calibration performing in the hospital will increase. Minimum equipment requirement is this much. That means at least a ICU with 5 ventilator, two maybe this defibrillator, such kind of specification comes in. Automatically it will impact the maintenance as well as the requirement of equipments. So that is a one way. Other way, but if there is any area, the government is now CDSU, as per the CDSU and MOEF regulations, it is preventing a lot of medical equipment import. So which is going to affect the availability of spare parts, availability of the machine. Then the this also will affect the uptime of the equipment. If spare availability is less, automatically the uptime will affect. Maintenance cost will increase. So these all things are happening in between because of the government, certain government rules, that mean policies. But of course, this is in a very preliminary phase.
Yeah.
It will stabilize over a period of time.
So my leading question here, Ajit, is that if more and more uh, medtech companies, Indian medtech companies, start manufacturing some of these high-end equipments, and I would love to hear your view on where are we heading. Would that slow down your growth for you, because there will be local service providers or there will be local competition that will come into play? So that is one question. Two is on the private healthcare. We're hearing a lot of private players accelerating their growth or expansion in the hospitals. We've heard about Policy Bazaar, wanting to enter into hospitals. We've heard about Aster, committing to some more capital to be invested. So, what is your view on the opportunity of working with the private hospitals?
Okay. I'll answer the first question where more medtech companies comes in India. It is definitely opportunity for us
Right.
because when there is a more and more medtech companies comes in, our cost of equipment may come down.
Yeah.
Then again, for those companies also for installing maintenance and all, they need a
Service
proper
provider.
service provider in this tier 2, tier 3 as well as a tier 1.
Yeah.
So our advantage is manpower. We have people in majority of the district. Currently, we are covering 235 district. We have people, resident people. That means that district wise we have people. So that is one of our advantage where we can work hand in hand with these kind of Indian manufacturers for a better service delivery. Wherein if they are going to deploy people, they cannot deploy each and every district this many manpower because they have a specific product. It can sell maximum how many numbers in a state. If it's a MRI equipment, a Indian player, maybe initially he can sell maybe one or two in a state. Going forward, maybe max to max, maybe they can sell some 5 or 6 equipment. You look at the ECG manufacturer or
Yeah.
you look at the patient monitor manufacturer. This is equipment cost itself is a 25,000 to 30,000. So they cannot deploy engineers in each and every district. Where our kind of solution provider can work hand in hand with them to provide a better service delivery, installation, post warranty, then including the warranty period, everything we can provide solutions to them. So that is definitely opportunity for us, no doubt about it. Second, when it comes to the private large players comes in. So when large players comes in, they are facing challenge of tracking these assets because their assets are in a different places.
Yeah.
And there is no centralized monitoring
So
mechanism.
that's part of the management, is it?
Yes, that's part of the management. And when it comes to a large group, there is a lot of areas they can cost cutting. They can look at the cost cutting, how effectively these equipments are utilizing. Then all the compliances, especially these regulatory compliances like Atomic Energy Regulatory Board compliances, calibration and NABH related compliances, everything is becoming important for them.
Yes.
So the equipment life cycle tracking is really important. So how many preventive maintenance, calibration, as I mentioned, like this track record, equipment history is really important. So these all are the area. Actually, it's an opportunity for us.
So, just on this point, Ajit, when you say tracking of assets is concerned, so you think there's an opportunity to build a tool or invest in technology to make sure, or I'm presuming you already have a technology. How do you currently also track so many equipments across your clients?
So let me just give you a small understanding about how we are maintaining our equipment. It is little more related to our operation aspects. So whenever we are getting into a hospital, any contracts we are signing, we will tag each and every asset where
Correct.
there is a specific asset barcode
Yes.
is there where equipment ID and there is a centralized toll-free number. If there is any complaint, they just need to dial that toll-free number and dial this barcode. Automatically that call get logged. Immediately, whoever is the respective engineer in that particular territory, a message will go to that particular engineer through his mobile app.
So it's
So this
currently
is a
you already have a
centralized
system.
dashboard. There is a mobile app facility that alert is going to our respective engineer in that area
Yeah.
because these all are centralized dashboard based.
Correct.
Message is going to the respective person in the hospital also. That saying that okay, this is a ticket number, this is a contact person. As per our current TAT, our person will talk to the end user or the respective person within half an hour. That
Yeah.
means there is a virtual touch.
Yeah.
And if it is in major cities, within 2 to 3 hour physical intervention, if it is we are unable to resolve it through phone, our person will be there in 2 to 3 hour time.
Yeah.
Once after reaching there, he will punch in so that it is that call is already logged in a physical intervention. Then after rectifying the complaint, there is a service report. That service report they will attach in the dashboard so that that complaint
It's
record
registered.
is already
Yeah.
maintained. If there is a spare required, there is a spare parts ordering mechanism through the app
So there is an
itself.
integrated system you
Yes.
already have.
So how many spare parts replaced? What frequent? How many complaints happened in a year? How many preventive maintenance done in a year? What is the user training happened in a year? So everything is
Captured.
tracked,
Yeah.
captured and tracked. so that it is easy that if tomorrow if anything related to this medical legal issue or whatever is there, all this equipment history they can produce it.
And Ajit, what was your reason for raising external capital? And two, maybe a leading question that you can answer also is, do you think you'll raise more capital in the next 12, 24 months?
So anyway, good question. In the growth process, as I mentioned, we are planning to get into different
Markets
government
and yeah,
markets where it is a fairly large project. For getting into that, we need to hire more people, more talents, more infra. We need to build tools, process, everything. There is a cost involved. So growth capital is really required for us for
yeah,
our getting into next
enter into
level,
larger
getting
projects.
into
Yeah.
next level. So along with it, when we went through this process, we also understood there is a there is a lot of small and medium gaps because we were focused more into the operation side. So we understood the importance of system driven, process driven, tools driven. So
Compliance.
yeah, compliance driven. So we got a lot of insight, and which helped us to become more into a professional
Professional.
organization, more into a process driven organization. So this was one learning which we received during this fundraise process.
And my next question was, you still think you will need additional, or you're seeking more growth capital in the coming 2 years?
Inorganic way, when we wanted to grow inorganically, definitely there is a certain acquisitions
Correct.
required. So for that acquisition, we need more capital. Of course, we need more capital.
Right.
So we are planning to grow both organic and inorganic way.
My next question, Ajit, is how do you think, and some of it you've already answered, so you may choose to maybe keep it short, on creating value for the investors, right? What is your view on how do you plan to create value?
So one is the business aspects. We are planning to get into more into pre-owned medical equipment sector,
Yeah.
where which is a the need of the market at this moment. Because
So you want to acquire pre-owned
yeah,
equipments?
pre-owned medical equipment suppliers
Yeah.
and some of the service providers, certain specialty service providers in a region, so that we can get into new market as well as we can acquire certain more clients, and we can get some technologies also. That means certain area wherever we have a technological gap, know-how gap, those kind of organization, when we are acquiring it, those or that technology and that their know-how will help us to get into little more larger areas and spectrum, little more larger equipment coverage, I can say, because
Right.
we are a service provider. So we wanted to know the technology and technique of all this current available equipment also. So when we are getting into such kind of acquisitions, we are expecting certain such kind of capability we can build internally. Through that, we can.
Adjacent capabilities to your existing.
Yes.
Okay.
So that is a one thing. Then pre-owned medical equipment and proper refurbishment. As per the guidelines, the proper refurbishment facility we are planning to bring, which will definitely give a lot of value addition. Then again, the training area, where the user training and the training to the technicians, which is now the skill development is one of the major gap what we could identify from the market. So we are getting into that aspects too. And component level repair is one of the another area which we are bringing in, which is definitely a value addition to the client as well as the it creates more sense, because nowadays what is happening, the entire, if a complaint happened, the entire module needs to replace. That is highly expensive, wherein we have a
Components, if
yeah,
you,
component level repair facility which can minimize the maintenance cost.
I'm sure with expanding globally, increasing global footprint, that will also, I'm presuming, will have higher margins for servicing some of the global markets.
Of course, the Middle East market, especially Saudi, is growing. Saudi is a huge potential. There is a lot of growth is happening in Saudi,
Yeah.
where we have a presence. We are working similar kind of activity happening there in Saudi. Now we are in UAE and Kuwait. And UAE, one advantage is the globally the people are depending on UAE for the pre-owned medical equipment. It is also a kind of a hub where a lot of pre-owned medical equipments are coming from different part of the world to UAE, and it is going to the African countries also. So that is one area where we are seriously looking into, which anyway we have the presence, we are increasing our presence and capability there.
No, thank you so much, Ajit. Last question from my side, Ajit, is any final comments, one or two comments on the outlook of the industry? How are you? I think you're sweetly positioned today for the next journey of growth. Uh, how, what would you want to say about the relevance of ESG? Why, how is it important for your next growth journey and some of the initiatives you're taking in that direction? Happy to hear your thoughts.
This is a one important area when you mentioned ESG. This is a one important area which we also took it in a very serious manner
Yeah,
once the investor came into the picture. What a business organization responsibility to the society, environment, what all are the impact we can create to the environment. These all are, we were doing a lot of things. Actually, it was not, we were not measuring this and how much impact we created in the during our last so many years. I'll tell you some of the examples. When we got into UP in the year 2018, when we went there, during that time, 24,000 plus medical equipment asset they proposed for condemnation.
right.
When we got into it, we repaired 14,000 plus assets and brought back to functionality. That
14,000 out of 20,000.
24,000.
24,000.
24,000. So which is more than 50% of the assets we brought back to functionality. What is the benefit? That much of equipment supposed to go as a e-waste,
Waste. Yeah.
which we brought back to functionality. That is one. Second thing, there is a huge cost saving to the government. With that itself is very close to 100 crores plus.
Wow.
That particular equipment cost itself is more than 100 crores. So that revenue leakage we reduced. Then that much of equipment available for the patient care.
Correct.
So that is another thing which we could bring back. Then again, when we are also disposing a certain material, that means our the residual electronic boards, we also started focusing on how we can discard in more effective manner without affecting the environment. Then the occupational safety, this is the one thing which we are seriously looking at it. So these all are, and again, we could create 1,200 plus jobs out of 120 plus from the this one female employment also we could bring. So these all are, we are thinking that these all are a impact which we could bring to the society due to this business
Initiatives.
Yeah, due to this initiative.
Excellent, Ajit. So while I would love to talk to you for another half an hour, but I think it's for the format of this discussion, we'll probably bring it to a close. It was wonderful talking to you, Ajit, and thank you so much again from coming here, joining us for this session.
Thank you, Vishal, for the invitation and the time.